Aging is a fact of life. It is a privilege that many of us are able to lead such long, fulfilling lives in Australia. However, aging is associated with a decline in physical and cognitive function and reduced health. Additionally, many older Australians are faced with social isolation and loneliness. Loneliness is associated with the quality of social bonds an individual has, rather than the extent of their social interactions. Loneliness is multifaceted and relates to an individual's feelings, relationships, sense of connections, changing circumstances, and point in their day or even their life. While evidence suggests that the majority of people aged 65 and older are not lonely or socially isolated, elderly people are more likely to be affected by loneliness than middle-aged adults. Socio-demographic factors, health risk factors, and life event risks can lead to social isolation and loneliness in the elderly. These factors can be identified in Ruth in the novel The Night Guest by Fiona McFarlane. For example, she rarely had somebody with which to discuss her feelings. Her sons had begun to worry about her rather than treat her as an equal, and she was adjusting to her new life as a widow. Meanwhile, the entrance of Frida into her life was a significant life event while she was trying to navigate old age. There are various negative consequences of social isolation and loneliness. Associations have been found between loneliness and poor mental health, physical health, and reduced life expectancy. In fact, feelings of loneliness has been reported to be a bigger risk for premature death than smoking and obesity. The feelings of a lonely or socially isolated person is more likely to experience include anger, sadness, pessimism, vulnerability, and negative self-worth. Consequently, social isolation and loneliness in the elderly is an important issue for health professionals to help address. This doesn't have to be complicated. Health professionals just need to keep this in the back of their mind when planning interventions. For example, in a hospital or residential aged care facility, this could be as simple as arranging group activities such as exercise classes rather than individual treatment sessions. In community and private practice, this could be a 5-minute conversation about the options for increased participation in the community and the benefits of this.
There are multiple other benefits of a community-based exercise program in assisting the increasing elderly population to age gracefully. The elderly community will have access to sunshine, meaning greater vitamin D to assist in the maintenance of bone strength. This will help to mitigate the risk of osteopenia and osteoporosis. In addition, the balance challenges of walking on uneven surfaces, such as those found in a park or on a beach, will further aid in the prevention of fall-related injuries common in this population. Incorporating an endurance component will have additional benefits for the cardiovascular system, aiding in the reduction of multiple systemic diseases.
Work those leg muscles, functional activity!
Almost worn out.
Community-based programs provide consistent timing and structure. This is an important component health professionals need to consider to slow down declining cognition in the elderly population in general, but particularly with patients who have dementia.
1. Well done.
We're going to have to go home for a little lie down.
Physical exercise has been shown to have positive effects on cognition, agitation, mood, mobility, and functional ability with dementia patients. Having consistency in program provision helps to orient patients so they are less fearful as they are more aware of what is going on and therefore more confident in their own abilities. This increase in confidence has led to Betsy tackling trivia.
As the world's best female soccer player in 2018.
Group exercise provides opportunities for people to check in with the elderly population. If Ruth was able to get out in the community to an exercise class which involved social interaction, she would have had improved function, reduced cognitive decline, and reduced low back pain. All of these factors would have made her more independent and less susceptible to abuse. In addition, other members of the community would have been able to check in on her. It took only one instance of contact with Ellen for her to raise concerns about a potential abusive situation occurring with Frida. Regular contact could prevent situations such as Frida's abuse of Ruth from escalating so quickly.
So it sounds like you've made a real effort to engage in some of these activities, is that correct?
That is correct, yes.
And do you think that's had a positive effect on your mental health and how you feel?
Yeah, definitely. I feel a lot better when I get out and get exercise and meet up with the people who are involved in these groups. Yeah, no, and if I don't do it, if I have a day just at home all by myself, not nearly as happy as when I've gone out and engaged in some activity.